Good morning, it's May 11th today. My name is Jagenda Semakwaziksoka. Welcome to Good Morning Uganda Extra here on UBC TV. What another lovely day and another week that we are get to by the grace of God. Now, today is day 7 over the 14 days of the lockdown. It means we are counting down another 7 days to end the 14 days of the extension of the lockdown. Now, there are people religiously out there who are actually counting at the days. The bad news is that as we also continue counting the days, as we speak now, our toll for the COVID cumulatively is now at 121. And, well, many and the majority of these are truck drivers who are transiting through the country and those coming to Uganda or through Uganda. This is causing a lot of worries to Ugandans who have actually managed to do their best to ensure that we contain and suppress the spread of COVID-19 amongst our societies. What this means to us is what should we do? We now leave it to the President and the Minister of Health to give us a way forward on what happens and where we go next from here. Now, this morning with me in studios, I have two experts here from we're going to look at Mother's Day and, of course, the Nurses' Day, which I think is tomorrow. But the Mother's Day was yesterday, and Nurses' Day is tomorrow. And with me in studios this morning is Myron's sister here, Mary Najuma, representing the young nurses or the Nursing Now campaign. You're very welcome, Najuma.
Thank you.
A very good morning, and thank you so much for joining me here on UBC TV. And of course, Lilian Nwavine, she's a midwife and also a specialist on women's health. You are also welcome, Lilian.
Thank you very much, Jagenda. Good morning.
Thank you so much for joining me. Now, let's just start with the basics. I will start with you, Lilian. Just tell us about Women's Day. I beg your pardon, Mother's Day. What is there about Mother's Day that we need to know? Because to many people, is just make a call, talk to your mother, and tell her Happy Mother's Day. And now that we even can't send pleasantries like flowers and all the things, to just put this thing into context, let's start with that. What is this thing called Mother's Day?
Thank you very much, Jagenda, and good morning, Uganda, and a happy Mother's Day to all the mothers that are outside there in the whole world, around the whole world. Well, Mother's Day, it is a celebration where basically we are honoring the mothers of the families all over the world. And then, you know, secondly, we are honoring motherhood. Then we are also honoring the maternal bonds and also the influence of mothers in the society. So Mother's Day, it is whereby, you know, you come up and, you know, you try to at least send a shout out to your mothers, you know, appreciate them through different ways, give them, you know, send them messages, give them a call. That is very, very important because that makes them valuable. Okay. So in addition to that, why we are celebrating Mother's Day is because, you know, we have mothers out there and they have a big influence they are doing there. Mothers outside there, first of all, they are the first aid givers. Did you know that? And then secondly, you know, mothers outside there, they are the primary healthcare givers. Who taught you, for example, you know, how to comb your hair, how to brush your teeth, how, you know, to dress up and all that, you know, washing your hands and all that. So they are primary healthcare givers. And then in addition to that, mothers are nutritionists. I mean, they're the ones that, you know, teach you on the different foods that you need to feed on and all that. So they are really, really, very, very important. And there's no way we can forget to, you know, honor such people. And more to that, you know, they're like the heroes. Because at the end of it all, they have raised you up, you know, give the whole feeling of giving birth, raising you up, you know, nurturing you. That is all very, very important. So it is very important actually to celebrate Mother's Day. Okay,
very good. Now, you talked to us about Mother's Day, you talked to us about motherhood, and you also talked to us about maternal something.
Yes.
I will get to the maternal bit of it. And much as we're struggling and trying to do our best as a country to fight against the COVID-19 pandemic, we've also negated the fact that mothers still die while giving birth and all the things. Just give us the numbers, if you can have them, on the maternal-related deaths at this time, because you may lose a mother now or a wife or a sister to giving birth and not COVID-19.
Actually, do you know what is happening according to the current statistics?
I don't know.
You know, according at the beginning of February 2020, we registered, actually Uganda in particular registered 12 maternal deaths weekly. It registered 12 maternal deaths weekly. And then at the beginning of April, still this year, 2020, Uganda registered 78 weekly maternal death. So that is very, very, that is more than even times 6. So you can see that even amidst this COVID-19, we have very many mothers outside there that are dying from other, non-COVID related causes. So it is very important for us to prioritize maternal health. Because, for example, in Uganda, we have not had any COVID-19 death. But the mothers are dying from February, 2 months down the road. It is more than times 6. So that is really, really very...
Okay. Well, thank you so much, Lillian. Lillian is an expert on women's health. She's an expert or a specialist on women's health, and she's also a midwife. Now, to you, Najuma, you are representing the young nurses on the Nursing Now campaign. Now, two things. First of all, tell us what Nursing Now campaign means. And secondly, I also need you to decipher for us the difference between a nurse and a midwife, because she's a midwife and you are a nurse. To us, you do the same things. Tell us about this campaign, what it means, and your difference from a midwife.
Okay, thank you very much, Semakula, my brother. Good morning, viewers. Straight to Semakula's question. Nursing Now campaign is a global campaign, and it was launched in 2018 by WHO together with the International Confederation of Nurses. And why the Nursing Now campaign? It was after a study, it was a triple impact study, that was meant to find out the impact of nurses and midwives at the same time on the healthcare system. And it came to remind us that nurses and midwives contribute the biggest percentage of the healthcare workforce. And me and you know that.
Globally,
when you go to the villages, globally, it's not only here in Uganda.
That's undisputed.
And yet,
70% actually.
Yeah, definitely. And yet they are underutilized, I would say. I would not say they're undermined, but they're underutilized. They have so much capacity. They can sit on policy making tables. They can change systems, they can transform health and healthcare. But we do not seem to harness their energies and their knowledge and their expertise. So WHO came up and saw that, and they said, hey, wait a minute, let's make a campaign that looks out for those nurses and brings them on board into the limelight so that the whole world can know what they are. And it's been going on since 2018, but it doesn't seem to have caught the momentum yet. But I don't want to say thank God for 2020, because 2020 has brought us so much into this limelight to show the world that, hey, look here, this is serious. They actually do matter, and they uphold the healthcare system. So the campaign is meant to empower nurses. There's some of them who are there, down there in the villages. You know the nature of education that we start with, mostly here in African countries. It's very minimal, and it's on the bare minimum. So when the more educated you are, the more empowered you get. So here we use the bare minimum education to practice. And it leaves us not empowered at all. So you don't feel like your opinion matters, because you think about, how much knowledge do I have to suggest something? So this campaign comes out to empower you, to tell you, hey, wait a minute, look here, you matter. If you're not in the wards, patients are not going to receive their medication. You matter, because if you're not around, people are going to definitely die. If nurses woke up one day and they strike just here in Kampala, you would see the number of deaths that would appear. So the campaign is aimed to empower nurses, to help them come out, to bring them at the decision-making tables, and also to remind governments that you have to invest in nursing and midwifery, because when you look at things, they are the people who are upholding the healthcare system. So that's the campaign. Okay,
nurses and midwifery now. Is there a difference, or you are the same and no?
Yes and no, because nursing, when we talk about nursing, we are talking about midwifery at the same time. But when we come to the distinctive practice, midwives have a role they play that is a little bit specialized, because they deal with the women affairs, specifically women. They don't look at anything else outside that. Women, newborns. So it makes them distinctive and separate in a way that they practice. And that brings about a little bit of a difference, but when you go on the outlook, when you mention nurses or nursing, you're talking about midwifery, because it's the kind of work that we do kind of intertwined.
Are there male midwives? I do not know, but I think they are
Very much so.
There's
There's so many male midwives.
Give more addition to that, because when you're talking about midwifery, it is a profession also. So meaning, basically, you're looking at the care of women before pregnancy, during pregnancy.
And these are not called mid-husbands.
No, that's right, and I add on to that. So you're talking about, the care of the women before pregnancy, during delivery, and after delivery, and also the care of the newborns. So it is a profession. That means it is not gender sensitive. Here, what we are looking at, or what we are focusing mainly at, are basically the skills, the knowledge and the competencies of someone. So it does not matter whether you're a male or a female, because when you nursing and midwifery have originally been known to be, more of like a feminine profession. But now here we are focusing on knowledge, skills, and the competencies to be able, to stand out and, be able to save the women. So we are not looking at gender. So meaning we have male midwives.
Okay, how has the access been to health services, the other related health, maternal services, like the antenatals, the postnatals, and all stuff like that during this period of the pandemic, more especially from you now, the expert?
Thank you very much, Jagenda. When you, before I gave you the statistics, so you can really see that in regards to maternal health, we are not doing well. We have not had any COVID-19 death, but we have had a lot of maternal and neonatal death during this period. So that means we are not doing well. And in addition to that, why we are not doing well, first of all, most of the focus, or a lot of focus, is a lot of finances, a lot of resources, a lot of funds are focusing on fighting the COVID-19 pandemic. So that means the maternal health and child health sector has been totally neglected. And the reason why we are having a lot of mortalities, a lot of death, a lot of morbidity. So that means there is a lot that we still need to do. Even amidst the pandemic, we need to focus on these areas. We need to focus on these, kind of sectors, because they are very, very, very important. And the leading thing that, one of the leading factors that is contributing to this mortality is, the directive of banning public transport and private transport.
The lockdown, basically.
Yes.
The
lockdown, the lockdown has, had a great impact. And the second is still, first of all, the health workers also, they are unable to access the health facilities. So the mothers themselves can't access the health facilities. The women, the nurses and midwives cannot be able to also access the health facilities. So that is a very big impact that is affecting the maternal and child health sector.
Okay, how come it's terrible for health workers to have access to the health facilities? All these ambulances, Parliament, for example, all the members of Parliament gave in the ambulances. The President directed that all government vehicles be taken to the DHOs at the district headquarters. What's the problem? And if you are the frontliners, why are you failing to access? And what is this thing? And how do you want to be helped now? Because COVID is still before us, maternal health is still before us, and all the other sicknesses are still before us. What do you have to do?
Okay, just to mention something, it's not actually failing, it's not complete failing. They're trying their best. Gateway gave an offer for buses in Malawi somewhere. Yeah, I'm seeing like more than 3 buses carrying health workers, but it's just that they're not enough. They're just not enough. And you talked about ambulances. In our practice, in the healthcare practice, you cannot use an ambulance to carry people who are okay and because they're just going to work. The ambulance is supposed to be for emergency service. So you cannot intertwine the two. So what we are supposed to do, maybe just whoever is concerned, maybe the task force and whoever, just to think deep as we're thinking about all the other issues surrounding COVID, think about how does this essential health worker, as the President says, how does this essential health worker access service access the work that they do more effectively? Because yes, they're trying, there are some transport measures put in place, but they are not enough. Personally, I have missed going to work for a few days, actually weeks, because where the bus passes, the bus passes through the main roads. It's a highway, it's a big bus. It cannot now come into the inside stuff.
It has to find in the main road.
It has to find in the main road. But for me to reach the main road, I have to walk like 2 kilometers to get to the main road. And by the time I reach the main road, I'm exhausted, but I'm going to give care. So you don't want to see a health worker giving IV something that's not right, or reaching the hospital and they're already burned out. Because the kind of work we do also is just one that makes you burn out even when you have the best of the condition.
Be realistic to me, my sister Najuma, and tell me how your attitude is towards patients in this time. You as health workers, I want to know. Tell me very realistically about the attitude.
Maybe what I can.
Thank you so much. Let her first
respond to that, Mary.
Thank you so much, Mr. Semakula. I can tell you, for us, business is as usual. Because the things that you see that are shocking you now are the things that we have been living in all the days of our lives since we signed up for this. So I've been seeing my people putting on masks and they are struggling with the mask. Oh my God, it's so hard for me to breathe in this mask. And we tell them, I wear a mask for 8 hours assisting a surgery and it's okay. So for you wearing it for 1 hour and you're complaining. So I can tell you that we've seen harsh things and we have survived all of them because we signed up for them. So to us it comes from the innermost of our hearts to care, and we are not moved by what's happening around us. As long as we can be able to find what to use to give the care, we will give the care even in the wartime. If you go back to the history of nursing, it was birthed in a wartime. So this is how we know how to do best. This is what we know how to do best. Harness the moments when life is hard, and then for us we just take it as
the president has actually recommended, and well, I don't want to say castigating it, but we now, the artists, he calls us now the Shakespeares. He's, I think, now run away from we the Shakespeares, even when he partly belongs to us. He's now gone to you now, the scientists, and every good praises now that come from the president are to the scientists. How do you receive these comments from His Excellency when he talks about you, and how do you interpret them? And where do you think these will actually take you, or they will only end on TV and radios?
Well, the fact that the president is coming up actually to realize the importance of nurses and midwives, to realize actually the impact of the nurses and midwives, it is something that actually makes us very, very, very happy. You know, being able to be appreciated for what you're doing is very, very good, rather than, you know, taking things for granted. But I'm happy that now the president comes up and, you know, talks about what nurses are doing, what midwives are doing, what doctors are doing, and basically general health workers. So this is very, very good. And this means that in the near future, really, the health sector needs to be prioritized. The health sector needs to, you know, to be at the center of it all. Even when you're investing, you're doing the budgeting, you know, the allocation of funds and all that, a lot of emphasis and a lot of funds need to be allocated to the health sector, because you realize that health is wealth. I mean, without being, you know, without being healthy, then you cannot be productive. So a healthy community is a productive community.
Mary, Nurses Day is tomorrow. Why should Ugandans celebrate that, and what lessons we derive from it, and of what importance should it be for Ugandans to actually even imagine tomorrow is Nurses Day?
Okay, thank you very much, Semakula. Nurses Day is tomorrow, and I know for many Ugandans it may not be as alarming as it should be, but based on what's happening elsewhere in the world, I guess you see how people are dying and how they survive at the mercy of this healthcare worker, whereby they even get to decide, oh, we have so many these sick, and then this one gets to live, and maybe we can take this off and put it on this one. So it is that important that a nurse is to the whole world. Here in Uganda, we may have our own perceptions due to our own experiences, and I can tell you some of them are not very positive. But when you go to dig deeper, because when I was joining the profession, I was also asking myself, what am I going into? These people that they say that they're very rude, they're all these sorts of things. So, but then I took it to the other positive side and said, let me go and see what really makes them become this or be this. And when you go to dig deeper, you find, like you say, the president is advocating for us. Why would you think he's advocating? If we were getting the deserved remuneration, if we were getting the deserved facilitation, we're having the housing allowance and the do you know that we don't even have our own insurance? That I can fall sick, I'm a healthcare worker, and I have to figure out how do I get myself better? How do I get a treatment? Because I don't have insurance myself, but I'm taking care of somebody's child or somebody's so many children or somebody's mother, but I'm not sure about my health. So that comes back to the way my output. Because I cannot have a sick child in the house. I don't know how they're doing. I don't know how they're going to survive this. And I come and take care of your child. So in Uganda, we have this perception that they are rude, they're everything, but it's because of the kind of life that they're living. So the public, how is it important for you to celebrate Nurses Day with us? It's you push the policymakers, push the government and tell them, hey, look here, this person matters. Because no matter where you go, even if your child fell sick and you're well-to-do, maybe you go to Nakasero or AAR, guess who you'll find? You'll find me. Because I've gone to school and that's why I'm qualified to work. But remember, I don't have insurance for my own child. So even if you go to the most posh hospital or to Mulago, you'll find the nurse, and it's the same nurse, and they're getting the same pay, and their kind of life is the same. So you need to celebrate them, empower them, so that when you find them in service, they'll give you the best service that you deserve. So hence, a call to the general public. Celebrate the nurses. Encourage them, empower them, advocate for them, push our ideas. The legislators push for us those things, the ideas that we need. We don't like, for example, we're following an act that was enacted in 1996, and we're trying to push for it to be changed, but it's taking us years.
And I think you're very young at that time.
Maybe what I can add on to that, in addition to celebrating International Nurses Day, as she said, nurses are doing a very crucial role. You realize that actually globally, more than 70% of the healthcare sector is comprised of nurses and midwives. So you can imagine such a huge workforce. That means it's a very big workforce.
Oh, that could be the undoing, that we can actually have so many nurses in a go as opposed to having specialized doctors. Maybe that's why we do not respect you, because we can have as many as we can at any given moment.
Well, I wouldn't like to go that side. I wouldn't like to go that side because I believe...
It is just my pedestrian thinking, because I'm not Shakespeare.
Because I believe speciality or specialization, actually specialization is very, very important in order to have quality care and to have a difference. Because here we are looking at where you can be able to provide services, quality services, and you become of a difference. Not whereby you're just providing services and it's like the usual, the day-to-day thing. We want to have nurses and midwives who can provide quality care so that the mothers, the patients, the clients outside there can have that kind of satisfaction, so that the next day they can come and say, okay, I would like to see my midwife Lillian. The next time they would like to say, I would like to come and see my nurse Mary. Something like that. So, and in addition to that, why nurses need to be celebrated? When you go outside there, for example, in Uganda, at health center 2, can you imagine? There is no doctor. There are only nurses and maybe a midwife. When you come to health center 3, there are only nurses and midwives. When you come to health center 4, you have only one doctor. So who do you think is doing all that other work? So they need really to be appreciated for the work they are doing. And that means they have a very big impact that they are putting outside there.
And just to answer your question before you go to the next one, where you said don't you think you just need one consultant instead of having so many? But I can remind you, how many people can a consultant see in a day?
I don't know.
Like so few. But if you have a nurse on a ward, how many people does she have on the ward? She has multitudes of patients. Like in Nago, you can find a ward of over 60 people against like 3 nurses. So if I have just one person who is a consultant, we will have a slow system. So we want to harness the system and make it synergized, to have at all levels, to have people. You don't just say we can exclude these and just have one. No, you have to have it synergized together so that the service can be abundant.
Well, I have another set of view actually, part of your team who are supposed to be with me here. There is Nanyonga and another one,
Irene
and Irene at Hyre. They're actually supposed to join me here. Still on the same thing because I couldn't have all of you here. But finally to you, Mary, a message to the young nurses, especially those that you're representing on this campaign of the Nursing Now. Then Lillian, you also have a final message to the mothers out there. Lillian. Brother Mary.
Thank you very much. To the young nurses out there, I just want to tell you that you matter so much, and you are the future of this profession. So all I want to tell you is harness whatever that you're doing. Love your profession, be confident, and be outspoken out there. Give your service with all diligence and focus at how you better your profession. Don't just remain at the level that you've acquired now. You can even go up to a PhD. Dr. Clark is coming. You're going to see her. She has a PhD in nursing. So you can go and specialize, become a specialized nurse, become a specialized midwife. Don't just see yourself so near. Let your dreams be big and aim higher to better this profession.
Well, thank you so much, Najuma. Finally, Lillian and Nwawine, your last message to the mothers out there.
Thank you very much, Jagenda. Basically, what I would like to tell the mothers out there is, first of all, even amidst this COVID-19, I would urge you, us as nurses and midwives, urge you to continue getting the services, even amidst, the public transport ban, the private transport ban. You are able to, to be able to call an ambulance, or even, to be able to get a letter from the RDC. Try as much as possible so that you can be able to get all these available services, be able to go for antenatal care, be able to deliver from a health facility, not a community. Okay, and then in addition to that, be able to also go for postnatal care, the family planning, the family planning services, be able to take the children for immunization, be able to be screened for the different, sexually transmitted infections, HIV, AIDS, and all that. And in more to that, even amidst this COVID-19, we urge you, our dear mothers outside there, to keep washing your hands for at least 20 seconds, to, sneeze or cough, under using tissue, and then you dispose it off. Be able to keep social distancing. Let us be as good as possible, and let us also try to go for maternal and child health services. Thank you very much.
Well, I want to thank you so much, Lilian Wabine, a midwife and also a specialist of women's health, and Mary Najuma, a representative of the Young Nurses or the Nursing Now campaign. Now we'll take a break, and when we return, we'll have Irene Athaire, and she's the nursing advisor from Seed Global Health, and she'll tell us more about that, and Dr. Rose Clark, who is also the Vice Chancellor of Clark International University. Thank you so much. We'll take a break and return shortly.
During this pandemic, every little contribution helps. Help those most affected by the effects of coronavirus. You can donate to the Red Cross using MTN Momo Pay. Simply dial *165*3#. Then enter the code 191919 and follow the prompts. Remember, using MTN Momo Pay is free of charge. Let's fight corona together. This is an initiative of the Uganda Red Cross Society, supported by
Everywhere You Go, MTN.
The Ministry of Health informs the general public that cases of coronavirus, also known as COVID-19, have been confirmed in Uganda. The ministry reassures all people in Uganda that there is no need to panic, as all measures are in place to prevent the spread of the virus. We need all your collective efforts to ensure that coronavirus does not spread in our homes and communities. The coronavirus symptoms include fever, cough, sore throat, sneezing, difficulty in breathing, and body weakness. Coronavirus is spread from human to human when an infected person sneezes or cough droplets come into contact with others. It can also be spread when a person touches a contaminated surface, then touches their eyes, nose, and mouth. To prevent coronavirus from spreading further, please take the following measures. Avoid close contact with persons who show flu-like symptoms. Avoid handshaking and hugging at all times. Keep a distance of at least 2 meters from the next person. Cover your mouth and nose when sneezing or coughing with a tissue, handkerchief, or bent elbow. Regularly wash your hands with soap and running water or alcohol-based rub, such as hand sanitizer. Do not spit in public. Find a secluded place like a toilet or pit latrine in which to spit. Cook meat and eggs thoroughly before eating. Avoid unprotected contact with live wild animals. For further information, please call the Ministry of Health toll-free numbers on 0800-100-066 or 0800-203033 or 919, or send a free SMS to your report on 8500. This message is from the Ministry of Health with support from World Health Organization and UNICEF.
Okay. Well, thank you so much, and welcome back from that break. We again continue with the discussion here, as I promised you earlier. Now with me in studios is a set of two guests, Dr. Rose Nanyonga, the Vice Chancellor from Clark International University. You're very welcome.
Thank you very much. Thank you for having us.
Thank you so much for joining me. And my other colleague here, Irene Sasira?
Atuhaire.
Atuhaire. Also with me here from SEED Global Health. Is that so?
Yes.
Yes, briefly, what is SEED Global Health?
So SEED Global Health is an NGO, just like a number of NGOs, but our main area of focus is education, practice, and policy. And we are trying to strengthen universities and public institutions to improve or strengthen their education for doctors and nurses. And our focus areas are emergency care and maternal, neonatal, and child health. So in summary, that is what it is. Maybe just to highlight a little bit, we're working with 5 public universities.
That's very important.
Makerere University, Mbara University of Science and Technology, Muni University up in Arua. I don't know if you've been there.
Muni, I know where Muni
Lira
is.
University, Abusitema University.
Okay, these are the public universities that you're working with. Why public universities only?
So we sent out a call for proposals, and we had a number of proposals coming in, and we chose the best. So it so happened that
the best proposals from those universities?
Yeah, the best were from the public. Yes.
Dr. Rose, I'm happy to have you here, and of course I'll start with you. When Najima was actually going out to say, Dr. Rose is here with a PhD in nursing, and of course encouraging the other young nurses out there who are actually looking at you and thinking maybe with time to come, they might also now be doctors with PhDs in nursing and wherever that is. Now I'll straight on go to tomorrow's day, which is the Nurses' Day. What is in this thing that the nurses out there need to actually celebrate and even talk about?
I think, thank you, Mr. Zuksoka. I think people easily forget that 80% of our health outcomes are driven by nurses in the health sector. That's a very important figure to remember, because if you didn't have nurses there, then that means that 80% of everything that we do, that we strive to do in the health sector, is going to have a gap. But most of the time, I think that nurses and midwives are relegated to a second-hand position. We only remember they are important when we are really sick and need them. And often what we have to say about nurses is quite negative. I sit in a lot of fora where people always have all these negative experiences of nurses and midwives. And they complain and complain and complain. And I often wonder, you know, midwives, as for example, are responsible for 2 million births in this country. We never actually...
2 million births?
2 million.
Every when?
A year.
2 million?
That means that a single midwife is responsible for about 5,500 babies that are born safely in this country. But we never actually talk about that. The scheduled reminder of the International Day of the Nurse really brings forward that idea that can we galvanize our efforts to not only celebrate the important work that they do, but also to be reminded of why it's really important for us to invest where it counts.
Okay, that's very important. Now, I think it was last week when we celebrated the Midwife's Day, the Day of the Midwife. And I just want to find the missing link in that. Why did we have the other day, a few days ago, and I think it's okay, this month, just last week, I think on Monday or so, we had the International Day of the Midwives. Now, tomorrow we have the International Day of the nurses. And you seem like you are one and you know, you're the same person. Why don't you marry these? And what is it that they did that time that you are not going to do tomorrow?
Okay. Is it?
Yes, you will.
Okay. I think that the scope of practice for nurses and midwives is very well defined.
Okay.
Midwives, you know, are responsible for a group, as they just talked about that, mothers and children, bringing, you know, children safely into the world. The scope of practice for nurses is quite wide as well. I think the intent for the 2 days was that it was born out of a persistent neglect of a lack of recognition for those groups. And it's important that when we look at, for example, the State of the World Nursing Report just came out, and it highlights that we are going to need 6 million nurses globally, but 5.3 million of those nurses are needed in the low-income countries. And I think that if you combine them, you sort of lose the importance of those data. We need to be able to have a focus on what do we need to build capacity and infrastructure for the nurses to practice optimally. And what do we need for the midwives to practice optimally? And those two scopes of practice require different investments and require different focuses. And I think that's why, but you are right that we do have an umbrella that brings the nursing workforce, when you hear that word, includes both the midwives and the nurses as well.
Okay, well, Irene,
Yes.
talk to us about your role now as nurses, especially in the face of this pandemic. Where you how you're making it through the challenges that come with that, because now the public is also now requested to put on face masks. We're putting them on because we are actually now moving into public sphere. How about now the frontliners who have actually been there and you are there? If 80% of you are actually supposed to be there, then what are these challenges or what are these opportunities that you're actually seeing in the face of this pandemic?
So thank you so much. So I'll start by generally the role of nurses in healthcare. Dr. Rhodes rightly said that 80% of the outcomes are caused by nurses. So as nurses, we play a wide range of roles, right from birth. You had the maternal health team talk about that. So we are with you from birth, and God forbid, to the time somebody leaves this earth. You find that it is the nurse who is there when you cry, when you have your first cry, when you're in school, it's the school health nurses, adolescents, it's the nurses with them. At the end, when you have a terminal illness, it's a palliative care nurse with you. And even, unfortunately, when you depart this earth, it's with the nurse who will see you take your last breath.
The nurses are with you when you come. They are with
But
you
with
all
you
the
when you
way
leave,
until
yes.
when you go.
Yes, so we have a wide
You don't
range.
even have to be sorry about that.
Yeah.
That's the Bible. It's
Yes,
just to
it's
say
fine.
there's a day
Yes.
for everything. There's a day for birth, there's a day for death. So you don't have to be sorry about that.
We really go through with you. We are basically the people in the community. 48% of nurses are in the community.
48%.
The rural community, yes. And when you try to compare with the other health professionals, you find that their percentages are lower. So nurses really are the ones who provide primary health care, that care that is affordable, that can be accessed by everyone in the community. So nurses will be the ones there. When we look at infection control, I'll talk a little bit about the pandemic later. Infection control, ensuring that the environment is safe for both the patient and the health workers, it is the nurse. Public health interventions, vaccination, sanitation, health education, trying to teach about non-communicable diseases, it is the nurse who is there. So specifically to talk about the pandemic, when we come to screening, when you come into the hospital, there are so many people. Some may have COVID, some may not have. So you find that it is the nurse who is there at the triage point, what we call triage, to screen out and say, this is a suspect, based on the different symptoms. So you find that they are the first interface that you will get in the pandemic. So they'll screen you out and then be able to take the other interventions. When it comes to care, provision of care, it's the nurse who is there. So we provide care, we ensure that you have your medication, we ensure that you're safe, you're not having adverse effects to the medication, we ensure that we've monitored you and we know that this person is deteriorating, this person is improving. We've been fortunate enough not to have severe or critical cases as yet in Uganda, but we have a special group of nurses called critical care nurses. When you're in the ICU, it is the critical care nurse who's going to be there to take care of you, ensure that you're breathing well, ensure that they have supported you to breathe, to feed, to take your medication. So basically that whole care continuum, it is the nurse that is providing it. When it comes to infection control, ensuring that all the health workers have the supplies they need, it's usually the nurses who are managing this. Maybe the doctors have the masks, the nurses have their masks. Hand washing is very important to ensure that everybody, no matter who it is able to take these infection control measures in place. When it comes to health education, when you look at the community, we've been lucky that we haven't had a lot of community spread as yet. But health education is very important, and it's the nurse. There's a very good photograph I've seen of a nurse deep down in Karamoja trying to educate the public. So it is the nurses who are there, and they'll play a very big role in health education.
Okay, well, that's very important. Have you been supported enough by government during this time, especially in acquiring TUI, the wananchi is what you call the PPEs?
So I was going to get to the challenges. One of the challenges is I had my colleague talking about recognition, but apart from recognition, meaningful involvement in policy, in planning. You find that many times as nurses we are at the implementation level, and rarely do we get to the table to meaningfully participate and have that contribution come into. So that's a challenge that we have. The other one is, of course, lack of adequate PPE. The government has tried. They are trying, they are procuring, but right now we have a scarce across the globe of PPE. So that's a big, big challenge that nurses have. And given that we're the first interface, and we also spend thrice as much time with the patient, we are at a particularly higher risk than our colleagues. So PPE is a big challenge. Transport, we had a ban on transport. And most of the nurses don't have private vehicles. So our colleagues were able to get stickers.
And you many, even if you all had cars actually, and you say all of you drive your cars, then it would still be another mess, even if you all had cars, because you're many.
Yeah, so different hospitals came up with measures, buses to take nurses, but we still have stories of nurses walking all the way from Namuongo to Mulago.
Where the bus comes or so?
Yeah, to be able to get to the facility. And they're doing it diligently. They have to wake up at 5 a.m., walk to the hospital, and be able to provide the care. Okay. So transport is a big challenge. Accommodation, training. The government has done a good job trying to train health workers, but we feel that nurses also need to be brought on board and trained, given the adequate skills to be able to.
She just talked about TRIAGE, yeah? Doctor, now let me come to you about TRIAGE. It's a very big discussion globally. And to my understanding was TRIAGE is, I decide Jagenda and Toro, who of the two should actually live and who should die. Yes. And when she talked about TRIAGE, and now I want to bring it to you. Tell us about that. And is it professional? Is it ethical to the medical workers to actually decide that let Jagenda go and let Semakula live?
I think it's not about letting Jagenda go and Semakula live. It's prioritization of who needs urgent intervention right now, and you are able to stage those patients in a way where you can divert resources to where. So, for example, if you have a patient who is not breathing and a patient who is able to walk into the clinic, so they are ambulatory, they are walking to you, they can sit. Which of those two patients are you going to, rush to first? It does not mean that the patient who walks into the clinic is not going to receive care, but we are going to prioritize those needs so that we can divert those resources to where the need is. And Mr. Zuksoka, I'm going to disagree with you because you keep saying that there are many of you. We actually don't have enough nurses.
You're not enough.
And midwives. Uganda's population has grown and it has outpaced the capacity of its healthcare system. We do not have enough healthcare providers across the spectrum. Not enough nurses, not enough midwives, not enough doctors, not enough laboratory, pharmacy technicians, and so on and so forth. We need to train more people so that currently our ratio of nurses to the population, the density, is only about 11 nurses to 10,000 Ugandans. Wow. The recommended figure ought to be at least 100 nurses to 10,000 population. So there is.
And we're just managing at 10%. We're just at 10% of that.
We are just managing
at 10%. If we're 11
10%.
And we need 100, then that's just 10%.
Exactly. And that impacts the triage system. Because if you have fewer healthcare providers per patient who is walking in, it means that you already are starting at a disadvantage. So you really need to optimize how you're using your resources, including your human resources, doctors and nurses and so on and so forth. And it is critical because during COVID, when the country opens, there's going to be a mad rush to the health centers. Partly because the people are still going to be afraid that they are maybe have come in contact with somebody who was in contact with somebody who was in contact with somebody, you know, one of those truck drivers and so on and so forth. You can really track, you know, a number of people, and people are going to be still afraid. The government is doing everything that they can. But when that population comes into the health center, it's going to be mixed. You are going to have a patient who potentially has COVID and a patient who actually doesn't, but they are just afraid that they may. And as nurses, we have to respond to all of that. So a nurse has to go through a systematic approach of determining which of these patients need care right now and activate a care pathway to address that need. So
what have you done to mitigate the challenges that, Irene, you just talked about now, you as the nurses in this country? Because, yes, there are challenges, and everybody is facing the challenges, but what have you done to mitigate them?
Absolutely. I think I'm very proud of the nursing leadership in this country. When the epidemic started, nursing leaders came together, drawing from a variety of organizations, including the Uganda Nurses and Midwifery Council, the Ministry of Education, the Ministry of Education and Sports, the Ministry of Health, academia, independent or other organizations, non-profit, and we formed a think tank. And the first goal of the think tank was to actually raise money to purchase PPE as a way to support frontline nurses. Our initial contribution, and as she said, nurses don't earn a lot of money, but we were able to raise nearly 20 million shillings. We purchased PPE, the basic package that includes a mask, you know, gloves, apron, goggles, and so on. We distributed those resources to both Mulago Hospital as well as Entebbe. We are now, we've taken a second wave of mobilization to be able to reach other places where the PPE is needed. And I think that that's really important as a nursing contribution. Now, that doesn't mean that we don't need more, and we do call upon the government. We did release a press release a few weeks ago that itemized the areas where we need advocacy and where we need help as a collective effort for the government to come in. And again, as she mentioned, the PPE is really important. She did mention everything else. I won't belabor the point she made. However, I want to mention one important other area that where nurses on the front line need is mental health. That's critically important. There's just a lot of anxiety and a lot of fear. And when you are working in conditions that are less than ideal, where you don't have all the resources, often you have only one pair of gloves or a mask that you are reusing all the time, you are constantly in fear that you are going to be the next victim of COVID. And that creates, you know, a need for mental health. And so a lot of healthcare workers, we know that this is true for all healthcare workers, for example, in China, in the United States and other countries where mental health needs escalate during the pandemic. So we would like to be able to focus on that as an area and be innovative in the way we create solutions for healthcare workers, whether online, whether on TV like this, you know, whether there's a number that they can call, create communities so that they can talk about what are the issues, what are they anxious about. We want a healthcare workforce that is healthy so that we can be healthy.
Well, thank you so much. Finally, to you, Irene, your last comments and your last could be an appeal to government or to the public as we celebrate Nurses Day tomorrow.
So
scientifically, moreover, because I think it's going to be celebrated scientifically.
Yes, it will be scientific.
Very good.
So there are a number of things, interventions that government and all stakeholders can do. One is pay, remuneration. Ensure that nurses and midwives are well remunerated. The other is meaningful involvement. Ensure that you are involved even in planning. Let us not be at the end where we are only implementing, but from policy formulation. The other is training. PPE, ensure that, you know, nurses and all health workers have the adequate equipment to protect themselves. The other is ensuring that, you know, all the logistics, transport, accommodation, they're all in place so that nurses can be able to get to their work Dr. Rose rightly mentioned psychosocial support, not only for nurses, for all health workers.
Okay.
It's a big need.
Okay.
Even to the community, you see after COVID is over, we shall have a lot of psychosocial needs.
Okay.
Yes.
Well, I want to thank you so much, Irene. Doctor, finally, your last comment, because in just a minute, and we'll be out of studios here as we prepare for senior ones are coming on with physics, and I think primary 5 is also coming on with mathematics after our program, finally.
Excellent. There is one call to action currently, and it comes out of the WHO State of the World Nursing Report. Invest in nursing education. Invest in jobs, infrastructure, and so on. And invest in leadership. We needed to strengthen nursing leadership, nursing and midwifery leadership in this country. And that requires investment. And Irene makes an important point. Inclusion of nurses. We do exist. We have the skills. We have the competency. We need to be at that table. We need inclusion in policy making and decision making because we know what conditions affect nurses and midwives.
How many PhDs do you have in nursing in this country, if you know?
About the ones that I know, about 5.
5 PhDs.
We needed to increase that number, Mr. Zuksoka. Like yesterday, a great deal of investment in that. Currently, I know that there are at least 60,000 nurses in the country, but only 40,000 of those are licensed to practice.
Only 40,000?
Only 40,000.
Of the 60,000?
Right.
So the 20,000 are just on the streets?
But only 2% of that figure have a bachelor's degree in nursing.
Exactly, and that's what is also surprising. I heard that from the minister here when she was here, Honorable Moriku Kaduchu. She came and actually revealed that to us here. Yeah.
So we need to invest there. You know, when you walk into a critical care setting, you want a nurse who can think on their feet, who can critically think, who can problem solve, who can, you know, and so on and so forth. And that takes a certain degree of education. So bring all the nurses up to the level where we can be confident of the nursing workforce in the country.
Well, I want to thank you so much, women, for joining me. And, of course, for the first set that was here, I'm surprised my guests here today mentioned all my names. Now, you called me Ziksoka. Najima was calling me Semakula. She didn't call me anything, but Lillian was calling me Jagenda. So all my names came out today very brilliantly, and I want to thank and congratulate all of you. If I had a fourth name, maybe Irene would actually say my fourth name, but I'm surprised. You called me Ziksoka, the other called me Semakola, another called me Jagenda, and that's where we are. Well, thank you so much. I want to wish you all the best, and we will join you in this struggle. Remember, we in the fourth set also at the front line with you. So as you're talking about yourselves, please remember to talk about us also. We also need the PPEs. We also need to have those protective layers. But anyway, thank you so much to all our viewers out there, and we want to ask you to join the nurses in this country as we celebrate the Scientific Nurses Day tomorrow. It's going to be celebrated scientifically, but the appeal is join them, pray for them, support them, love them, and do anything to actually ensure that they actually get there. Now, we'll stop this here, and I've just been told that the next on is Senior 1 Physics. Now, for you, the students at home, get ready with your physics books, because the teachers are coming on to teach us, and thereafter we will have primary 5 with mathematics. P5 mathematics also get ready. My name is Jagenda Semakola Ziksoka. Thanking you so much and saying good morning and bye for today.